RFK Jr. came into this hearing confident, ready to defend his record on drug pricing and Big Pharma. But when Senator Catherine Cortez Masto pressed him with one simple, direct question about protecting cancer patients from skyrocketing drug costs, he froze. The silence was deafening, and in that pause, the entire room realized just how unprepared he was. What happened next will leave you questioning everything he claimed.
Senator Cortez Masto.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on Big Pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed Big Pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo, and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on Big Pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. And what we found is that the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. It's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
Well, that is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those and bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure of that provision in the bill, of the one beautiful bill, but
You're not sure of the provision, the negotiation provision, and how exempted
for Keytruda?
Drugs? Your agency is responsible for that negotiation, and you don't know about it?
I know that we're negotiating in the MFN
Let me ask
negotiations.
you this, Mr. Secretary. Let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the rate?
They are going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to Dr. Oz about it yesterday. I think it's 16%. They're supposed to increase about 11.6% or $21.50 more each month. And again, last time we were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. You know, next year, seniors and families are facing higher health care costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6%.
to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing I'm already keeping costs down.
What are you doing to keep costs down for seniors, knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A Congressional Budget Office has said that that's brought premiums down by 5%. As the Congressional Budget Office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
for helping
costs.
Seniors. Does it impact seniors?
Does it impact?
Come on. Let me just stop here.
I didn't
My
hear
time is
what you
running out,
said.
so I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
Okay, let's go.
What just happened in that hearing goes far beyond a senator putting RFK Jr. on the spot. That pause you saw wasn't just a stumble. It was a moment that revealed how layered and complicated and sometimes contradictory America's drug pricing system really is. And this is where we need to slow down and unpack what's really at stake. Senator Catherine Cortez Masto pressed him on a bill that, at first glance, seemed to be about lowering costs. But buried inside, there's a carve-out protecting some of the most expensive cancer drugs, like Keytruda, which has been on the market since 2014, pulled in nearly $18 billion last year, and costs patients up to $175,000 a year. Families go bankrupt or simply forego treatment, while Medicare bleeds billions of dollars. Now, why does this matter? Because Americans are constantly told that their leaders are fighting to bring drug prices down. Yet when the policies hit the ground, the loopholes often favor Big Pharma over patients. This is where Senator Masto's line of questioning cut deep. It wasn't just about numbers, it was about accountability. When she asked why cancer drugs weren't being negotiated down, RFK Jr.'s hesitation exposed something bigger: how easy it is to campaign on promises, but how difficult, or perhaps inconvenient, it is to deliver when powerful industries are involved. That pause symbolized the distance between rhetoric and reality. And here's the bigger picture. Seniors are about to see premiums climb. Out-of-pocket costs are rising. A report shows Medicare Part B premiums are set to jump by over 11%, one of the largest single-year increases in decades. That means people who spent their lives paying into the system will now be forced to pay more just to access it. For many, that's the difference between covering medication and covering groceries. This isn't an abstract policy debate. It's people making heartbreaking choices every single month. What this exchange teaches us is the importance of details. Big speeches and bold headlines sound good, but the fine print of policy tells the real story. It's in the exemptions, the carve-outs, and the provisions that ordinary people often get left behind. That's why tough questioning in hearings like this is not just political theater. It's one of the only ways to force clarity on where our leaders actually stand when confronted with uncomfortable truths. So as viewers, we can't just stop at the soundbite. We need to recognize that every pause, every sidestep, every "I don't know" in these hearings has real consequences for the people depending on these programs. Seniors, families fighting cancer, working Americans struggling to afford medication, they're the ones who feel the impact when politicians can't give straight answers. And this is where you come in. Don't just watch this as another partisan clash. See it as a reminder that staying informed, asking hard questions, and demanding accountability are essential. Because if we don't, the system continues to bend toward the interests that already have the most power. So let's keep this conversation going. Do you believe leaders are doing enough to take on Big Pharma, or are patients still paying the price for Washington's compromises? Let me know what you think in the comments. And if you want more breakdowns that cut through the noise and explain why these moments matter to your life, make sure you subscribe, because the truth is always in the details.